Most men over 60 are making a mistake they don't even know they're making. Not a dangerous mistake, not an embarrassing one, just a quiet one. The kind that slowly drains your energy, messes with your mood, irritates your prostate, and leaves you wondering why you don't feel like yourself anymore. And the worst part, nobody tells you about it. Not your doctor, not your friends, nobody. The question is simple. What does daily ejaculation actually do to your body after 60? Does it help your prostate or slowly damage it? Does it boost your hormones or quietly drain them? Does it improve your sleep, your mood, your energy? Or does it take something away? If you've ever wondered about this, even privately, you're about to get a real answer. I am Dr. Natalie Parker, and if you want to keep receiving important content about health after 60, subscribe to the channel and turn on the notification bell. Because here's the thing. Most men are walking around with two completely opposite beliefs in their heads at the same time. One voice says, "It's healthy, keep going." The other voice says, "You're draining yourself, stop." And neither voice gives you the full picture. Today, I'm going to give you that full picture, what the research actually says, what I see in practice, and what your body is probably already trying to tell you, if you know how to listen. Let's start with what's actually happening inside your body when ejaculation occurs. Your brain releases dopamine. That's the motivation and reward chemical. It gives you that feeling of drive, satisfaction, pleasure. At the same time, your body releases oxytocin, which calms you down and creates that sense of connection and warmth. Endorphins flood in, reducing stress and physical tension. And then, a few minutes later, prolactin rises, creating that heavy, settled, almost sleepy feeling afterward. Your heart rate goes up temporarily. Blood flow improves. Your pelvic floor muscles contract and then release. And here's something most men don't think about. Your prostate empties stored fluid. All of this is completely normal. And for most men, regular sexual activity genuinely supports health. It supports circulation, it helps manage stress, it can improve sleep quality, and yes, it can support prostate function. But here's where age changes everything. After 60, your body doesn't recover the same way it did at 35. Testosterone levels are naturally lower. Muscle recovery is slower. Your nervous system becomes more sensitive to overstimulation. And your energy reserves, the deep reserves, take longer to refill. That means frequency that felt completely fine at 40 might be creating a quiet deficit now. Not a crisis, not an emergency, but a slow drain that adds up over days and weeks. And here's the scary part. Most men don't connect the dots. They feel tired. They chalk it up to age. They feel foggy in the morning. They think it's just life. They notice their motivation is lower, their sleep is lighter, their mood is slightly off, and they never once consider that their daily habit might be part of the picture. Your body is sending signals, and the question is whether you're listening. Now, I want to be very clear about something. I'm not telling you to stop. I'm not saying daily ejaculation is harmful. I'm saying it depends entirely on how your body is responding. And most men have never been taught to ask that question. Let me tell you about two men I've worked with, both in their early 60s, both with similar habits, intimate activity almost every day. The first man sleeps deeply, wakes up calm and clear-headed. Energy stays steady throughout the day, no pelvic discomfort, no urinary issues. For him, daily activity isn't a problem at all. His body handles it well, recovers well, and gives him no reason to change. The second man tells me a completely different story. Same frequency. But he feels drained the next morning, less motivated, a little foggy. He's noticing more nighttime trips to the bathroom, some tightness in his lower pelvis. His prostate has been giving him trouble, and nothing he does seems to fully resolve it. Same habit, totally different outcomes. So what's the difference? Recovery capacity, prostate health, nervous system sensitivity, and whether or not the body is getting enough time between sessions to fully reset. The question isn't how often. The question is how you feel afterward, not right after, but later that day and the next morning. That's where the real answer lives. Now, let's talk about the 5 most common mistakes I see men over 60 making, because understanding these can change everything. The first mistake is confusing habit with desire. This one is subtle, but it matters. Real desire comes from the body. Hormones, connection, emotional readiness, these are the signals that tell you your body genuinely wants this right now. Habit is different. Habit comes from routine, boredom, stress relief, a pattern that started years ago and never got questioned. When ejaculation becomes automatic, something you do at the same time, in the same way, without thinking, your brain starts to expect stimulation rather than respond to it. Dopamine release dulls. The satisfaction decreases. You keep going, but it doesn't feel as good as it used to. The fix is simple. Pause occasionally, not forever, just enough to let genuine desire come back naturally. You'll know the difference when it does. The second mistake is using ejaculation to manage stress or loneliness. This one is harder to admit, but it's incredibly common, especially in men over 60 who are dealing with retirement transitions, relationship changes, or the quiet isolation that can come with this stage of life. What happens is, at some point, the behavior shifts. It stops being about connection or desire and starts being about relief. Dopamine temporarily masks the stress or the loneliness, and it works for about 20 minutes, but it doesn't resolve anything. And over time, the satisfaction keeps dropping while the frequency keeps creeping up. A quiet frustration settles in that most men can't quite name. If this sounds familiar, the question worth asking is, what do I actually need right now? Sometimes the answer is rest. Sometimes it's human connection. Sometimes it's purpose. Something to look forward to, something to care about. The body often knows, we just have to ask. The third mistake is ignoring what your prostate is telling you. Here's something the research actually supports. Regular ejaculation can help maintain prostate health, keeping the gland active, helping it empty fluid regularly. This is genuinely beneficial for many men. Some studies suggest men who ejaculate more frequently may have a lower risk of certain prostate conditions over time. But, and this is important, more is not always better, especially if your prostate is already enlarged, inflamed, or irritated. A sensitive prostate needs time to recover between sessions. Daily stimulation of an already aggravated gland can make symptoms worse, not better. More urgency, more nighttime trips to the bathroom, more discomfort. For many men I work with, the sweet spot is somewhere between 2 and 4 times per week. That frequency tends to support prostate function without overwhelming it. But every man is different, and your body's feedback is always the most reliable guide. If you want a clear breakdown of the warning signs that your prostate may be getting overstimulated, along with the specific habits that protect it after 60, I put everything together in one place for you. The medical guide to avoid the mistakes that damage the prostate. After 60 is available in the pinned comment below this video. It's the resource I wish every man in my practice had before the problem started. Because most of what damages the prostate after 60 is completely preventable when you know what to look for. The fourth mistake is overworking the pelvic floor. Most men don't think about the pelvic floor at all, but it's one of the most important muscle groups in your body, especially after 60. Your pelvic floor contracts during ejaculation, every single time, and like any muscle, it needs recovery time. Daily contraction without adequate rest can lead to chronic tightness, reduced sensation, weaker control, and a dull, persistent discomfort that many men describe as pelvic pressure or heaviness. The answer isn't to stop being active. The answer is to balance contraction with recovery, and to strengthen the pelvic floor deliberately, not just stress it repeatedly. Kegel exercises done correctly and consistently are one of the most effective things a man over 60 can do for urinary control, pelvic comfort, and sexual function. Not intense, not complicated, just regular, gentle strengthening with built-in rest days. If you've never done them, or if you tried once and stopped, it's worth starting again. The difference after a few weeks is usually noticeable. The fifth mistake, and honestly the one that causes the most damage, has nothing to do with biology. It's shame. Here's what the science actually shows. Shame increases cortisol, your primary stress hormone. Elevated cortisol suppresses testosterone production, Lower testosterone affects energy, mood, motivation, and yes, sexual function and desire. In other words, the guilt and confusion that many men carry around this topic actively makes everything worse. The biology gets harder, the emotional weight gets heavier, and the cycle feeds itself. There is nothing wrong with desire at any age. There is nothing broken about a man in his 60s or 70s who still has an active sex life. Vitality doesn't have an expiration date, and the men I've seen struggle the most aren't struggling because of their habits. They're struggling because of the shame they attach to them. Your body is not punishing you, it's communicating with you. And there's a big difference, so let me give you a simple, practical framework. Pay attention to how you feel, not right after, but later that day and the following morning. That's your most honest data. If you feel rested, clear, and energized, your current frequency is working. If you feel foggy, drained, or physically uncomfortable, your body is asking for more recovery time. Adjust frequency gradually. There's no perfect number. There's only what works for your body right now, which may be different from what worked 5 years ago, and may change again. Support your recovery with the basics. Sleep, hydration, and nutrition aren't just general health advice. They directly affect how quickly your body refills its reserves after physical activity. Men who sleep poorly, eat poorly, and live under chronic stress recover much slower from everything, including this. Strengthen your pelvic floor deliberately, a few minutes, a few times a week, simple, consistent, sustainable, and release the shame. Not because it's a nice thing to do, because it is biologically interfering with your health. It raises your stress hormones, it lowers your testosterone, it makes every other problem worse. Letting it go isn't weakness, it's one of the most practical things you can do for your health. So back to the original question. What does daily ejaculation actually do to your body after 60? The honest answer is, it depends. For some men, it's completely fine. Their body handles it, recovers well, and shows no signs of strain. For others, daily frequency is quietly draining energy, irritating the prostate, and creating a slow accumulation of fatigue that they've been misattributing to age. The only way to know which category you're in is to listen, not to the loudest voice in your head, not to what you did at 40, not to what anyone else says is normal or appropriate or too much. Listen to your body, adjust accordingly, and trust that it's giving you the information you need, if you're willing to pay attention. You are not strange for wondering about this. You are not broken for asking. You are a man paying attention to his health, and that matters more than you know. If this video helped you see something more clearly, hit the like button. It helps more men find their way here. Subscribe to the channel because these are exactly the conversations we're going to keep having. No judgment, no shame, just honest, practical information that respects your intelligence and your experience. I'm Dr. Natalie Parker. Take care of yourself. You have more good years ahead than you think.